Right now, as you are watching this video, blood is moving through thousands of miles of arteries inside your body. Those arteries keep your brain alive. They keep your heart beating. They keep every cell in your body functioning. But for millions of people, those arteries are slowly closing. Silently. No loud warning. No dramatic symptoms. No obvious pain. Fatty plaque builds quietly inside the artery walls year after year. Then one day, the blood flow stops. A heart attack. A stroke. Permanent damage that can happen in minutes. And the most frightening part is this. In many cases, the body sends warning signs months or even years before it happens. The tragedy is that most people do not recognize those signals until it is too late. Today, we are going to look at 9 dangerous warning signs of blocked arteries that many people ignore. And number 7 may surprise you, because it often appears years before heart disease is diagnosed. Understanding what blocked arteries really are. Before we talk about the warning signs, you need to understand what is actually happening inside the body. Blocked arteries develop through a condition called atherosclerosis. This process begins when cholesterol particles, fat, calcium, and inflammatory cells begin sticking to the inner walls of blood vessels. At first, the buildup is small, almost invisible, but over time, it forms a plaque. That plaque slowly grows thicker. The artery becomes narrower. Blood has less space to move. Imagine a highway that slowly loses lanes until traffic can barely pass through. That is exactly what happens inside the arteries. When blood flow becomes restricted, the organs that depend on that blood begin to struggle. And the body begins sending signals. Signals many people overlook. Let's start with the first one. Sign number 1. Chest pressure that feels like weight. When people imagine heart problems, they think of sharp chest pain. But the truth is very different. Most people experience pressure, a heavy weight sitting on the chest. Some describe it as squeezing. Others say it feels like someone is pressing down on their chest with a fist. This condition is known as angina. It happens when the heart muscle does not receive enough oxygen-rich blood. The discomfort often appears during physical activity or emotional stress. But here is the dangerous part. Many people ignore it because the pain goes away after resting. That temporary relief creates a false sense of safety. In reality, angina is often the heart's way of saying, blood flow is not enough. But chest pressure is not the only warning sign. In fact, millions of people experience heart disease without any chest pain at all. The next signal is something people rarely associate with heart problems. Sign number 2, shortness of breath. If walking upstairs suddenly leaves you gasping for air, your body may be trying to tell you something important. When arteries become blocked, the heart cannot pump blood efficiently. Less oxygen reaches the muscles. The lungs try to compensate by increasing breathing. This creates the feeling of air hunger. Many patients say they feel breathless during simple activities like walking, dressing, or carrying groceries. The problem is that people often blame aging, stress, or lack of fitness. But unexplained shortness of breath can be one of the earliest signs that the heart is struggling. And sometimes it appears weeks before a heart attack. Sign number 3, pain in the legs when walking. Blocked arteries do not only affect the heart. They can also restrict blood flow to the legs. This condition is called peripheral artery disease, or PAD. One of the earliest signs is pain while walking. The muscles begin to cramp. The calves tighten. The legs feel heavy. Then something strange happens. When you stop walking, the pain disappears. But when you start moving again, the pain returns. This pattern happens because the muscles demand oxygen during movement. But the narrowed arteries cannot deliver enough blood. Doctors call this symptom claudication, and it is one of the clearest signs of poor circulation. But circulation problems do not always cause pain. Sometimes the warning sign is something much quieter, something most people blame on stress. Sign number 4, unusual or extreme fatigue. Many people who later develop heart disease report something unusual before it happens. They feel constantly exhausted, not normal tiredness. Deep fatigue that does not improve with rest. Simple tasks begin to feel unusually difficult. Climbing stairs becomes exhausting. Walking short distances feels harder than before. This happens because the heart must work harder to push blood through narrowed arteries. Every movement requires more energy. In many cases, this fatigue appears weeks before a major cardiac event, and it is often dismissed as stress or poor sleep. Sign number 5, cold feet or numb toes. Your hands and feet depend on healthy circulation. Blood carries oxygen and warmth to the outer parts of the body. But when arteries become blocked, blood struggles to reach those areas. The result can be cold feet, numb toes, tingling sensations. Some people notice that cuts on the feet heal slowly. Others see the skin becoming pale or slightly bluish. These symptoms indicate that tissues are not receiving enough oxygen. Over time, poor circulation can cause serious tissue damage. But one of the most dangerous warning signs does not happen in the chest or the legs. It happens in the brain. Sign number 6, sudden dizziness or weakness. Your brain is extremely sensitive to oxygen supply. Even a short interruption in blood flow can cause symptoms. If plaque builds in the carotid arteries that supply the brain, circulation can drop suddenly. This may cause dizziness, confusion, blurred vision, difficulty speaking. Sometimes these episodes last only a few minutes. Doctors call them transient ischemic attacks or mini strokes. A mini stroke is not harmless. It is often the final warning before a full stroke occurs. Ignoring these symptoms can be life-threatening. Sign number 7, erectile dysfunction. This is one of the most overlooked warning signs of cardiovascular disease. An erection depends on strong blood flow through very small arteries. Those arteries are smaller than the arteries that supply the heart. Because of that, plaque buildup often blocks them earlier. This means erectile dysfunction can appear 3 to 5 years before heart disease becomes obvious. For many men, this symptom is not just a reproductive issue. It can be an early sign that circulation throughout the body is declining. Sign number 8, pain in the jaw or neck. Heart-related pain does not always appear in the chest. Many people experience discomfort in the jaw, neck, shoulders, upper back. This happens because nerves carrying signals from the heart share pathways with other parts of the body. The brain sometimes misinterprets where the pain is coming from. That is why some heart attack patients report jaw pain before chest pain begins. Sign number 9, sudden sweating and nausea. The final warning sign can feel unrelated to the heart. Some people suddenly experience cold sweats, nausea, a feeling that something is terribly wrong. This reaction occurs when the nervous system detects stress on the heart. It often appears alongside chest discomfort or dizziness. For many patients, these symptoms appear minutes before a heart attack begins. Why arteries become blocked? Blocked arteries develop slowly through years of damage to blood vessels. The most common causes include high cholesterol, high blood pressure, smoking, diabetes, obesity, chronic inflammation, lack of exercise. These factors damage the inner lining of the arteries. Once that protective lining is injured, cholesterol begins sticking to the wall. Inflammation follows. Plaque forms. Over time, the plaque either narrows the artery or ruptures suddenly, forming a clot that blocks blood flow completely. That is the moment when a heart attack or stroke occurs. How to protect your arteries. The encouraging news is that many cardiovascular problems can be prevented. Start with diet. Choose foods rich in fiber, vegetables, healthy fats, and whole grains. Limit processed foods and excess sugar. Add daily physical activity. Even 30 minutes of brisk walking improves circulation and strengthens the heart. Monitor cholesterol and blood pressure regularly. Avoid smoking completely. Maintain a healthy body weight and manage blood sugar levels. These steps protect the arteries and dramatically reduce the risk of cardiovascular disease. Blocked arteries rarely appear overnight. They develop silently for years. But the body often sends warnings long before disaster strikes. Chest pressure. shortness of breath, leg pain, unusual fatigue. These signals are not random. They are messages from your cardiovascular system. Messages that should never be ignored. Because when blood flow suddenly stops, the consequences can be permanent. Protect your arteries. Your heart, your brain, and your future depend on them.